Good morning, friends. We begin today's program with the song Sri Madhava Vasudeva, a Papanasam Sivan composition rendered by Sudha Raghunathan.
Sri Madhava Vasudeva Devati Deva Keshava Sri Madhava Vasudeva Devati Deva Keshava Sri Madhava Vasudeva Devati Deva Keshava Sri Madhava
Friends, our speaker today is Dr. Rajan Ravichandran, Director of Nephrology, Mayotte Hospitals. The topic, Save Your Kidney, Only You Can. Dr. Ravichandran had a brilliant academic career. He stood first in Bombay University in medicine and surgery, with several awards and gold medals to his credit. Starting his practice in Chennai in 1985, he headed the Department of Nephrology in VHS Hospital, Adyar, then set up the Madras Institute of Nephrology at Vijaya Health Center. More than 20,000 kidney patients from all over India, as well as from Maldives, Sri Lanka and Bangladesh, were treated at this institute. He served as visiting professor at several colleges in India and abroad: the Sri Ramachandra Medical College, Chennai, Tokyo Women's University, and IIT Chennai. Then followed several research projects in collaboration with IIT Chennai. In May 2008, he was conferred the FACP at a convocation held in Washington, D.C. The following month, he was conferred an FRCP in Edinburgh. This morning, Dr. Ravichandran will discuss myths and realities concerning the kidneys and offer tips on protecting and saving kidneys. He will focus on high blood pressure, which is a major cause of death worldwide. He says that about 10% of the adult population in India suffer from a minor impairment of kidneys. Some 0.1% of these cases may deteriorate to a point where dialysis is required at a later stage. He says that victims of kidney damage may experience no symptoms till 90% of the kidneys are damaged. Ironically enough, the capacity of the human body to adjust to damage makes a person ignorant of the damage. Further, a person loses 1% of kidney function every year. Now, this is a scary statistic for people who are above 70. Dr. Ravichandran recommends 2 annual tests for the old, a urine protein test and a serum creatinine test. These may forewarn you about any damage to the kidneys so that you can take any remedial action before things get worse. Dr. Rajan Ravichandran has carried out many research projects to make kidney care affordable. For example, he designed and made an acute dialysis machine in 1997. This machine enables removal of fluid from the lungs of patients who are critically ill. It was successfully used in several Chennai hospitals, but could not be developed commercially. He's the architect and pioneer of kidney transplants across blood groups using Japanese technology. This is a major breakthrough in kidney transplantation in India and has benefited many. He also introduced for the first time in the world the concept of self-detection of kidney disease using a strip, something he'll discuss with us during his presentation. Dr. Ravichandran has been showered with honors from far and near. These include, to mention a few, the Dr. N.D. Patel Prize in Surgery, the Choksi Memorial Prize in Medicine, and the Charles Moorhead Prize in Clinical Medicine. He's the first Indian recipient of the Notable Achievement Award conferred by the World Hypertension League for reducing salt intake in the Indian population. A member of many professional bodies, such as the International Society of Nephrology, he has published several research papers in national and international journals. I asked Dr. Ravichandran how he relaxes. He's fond of Carnatic music. He tries not to miss the concerts of Sanjay Subramaniam, Vijay Siva, Malladi Brothers, or Bombay Jayashree. Mr. N. Murli, president of the Music Academy, told him, "You are very selective about attending concerts." He also likes Tamil plays. S.V. Sekar, Y.G. Mahendran, and Crazy Mohan are good friends. He plays golf on Sundays, snooker almost every day for about half an hour at the Madras Club. The South India Heritage Program began in February 2002. It offers the citizens of Chennai a series of talks by distinguished scholars and achievers. These are designed to promote awareness and pride in the rich heritage of South India. They have highlighted various facets of South India's heritage: science, history, philosophy, religion, architecture, culture, drama, cinema, music and the arts, even cuisine. Besides lectures, the Heritage Program has also presented music concerts, Harikatha performances and musical discourses, plays, films, book launches, and special events. It confers awards to encourage young musical talent and outstanding talent in heritage promotion by young achievers. The idea for the series of programs was conceived by Mr. R.T. Chari. The programs are sponsored by Mr. Chari and his brother, Mr. R.V. Gopalan, through the TAG group of companies and their family trust Ramu Endowments. Friends, we take pleasure in inviting Dr. Rajan Ravichandran to take the floor for his special lecture on Save Your Kidneys Only You Can. Those of you with cell phones, may please switch them off. Thank you.
Thank you, Mr. Madhu, for that kind introduction. For the last couple of days, he has been asking me so many questions. I thought he's going to steal my lecture. And I'm very happy to be here, of course, because I feel very young. So, my special thanks to Chari and Sundaram Mama for having given me this opportunity to talk in front of you. The message for the day is there right on the slide. Every person with diabetes or blood pressure should get his urine albumin checked at least once a year. Now, a little history about me. I was born in Bombay and my father was working in central government service. I was put into the SIWS high school. Some of you would know. I think Rajan is here. So the South Indian Welfare Society's high school. In those days, I directly joined the second standard. We didn't have all these KG, pre-KG, etc. And in the very first week, I still remember, my teacher was Saraswati. And Saraswati, within the first week, broke my slate, saying your handwriting is bad. So she is the first person who identified that I would be a future doctor. Subsequently, I am sure all of you know, in those days, the commonest essay topic was, what would you become in future? And half the class in my class wrote they want to be doctors. Another half engineers. So people want to serve the country, be doctors or engineers. And I was the only fellow who wrote, I would like to be a politician. Of course, not that I had any idea about politics, but I wanted to be different. That has paid throughout my life. Being different has always been appreciated. My teacher appreciated at that time that you have written a different essay. She called me to her room. And of course, in my class, I turned out to be the only doctor. Although 40 of them wanted to be doctors, nobody turned out to be a doctor. Now, how did I take up medicine? That again, there was no ambition as such. I was the seventh born child. So already other specialities were taken. Engineers were over, banking career is over, commerce is over. So it was a unique family decision that this boy should take up medicine. Fortunately, I stood first in the university, so medical admission was not a problem. I got in the best college, that is KM Hospital in Bombay, with a scholarship. Now, what did I learn first in the college? You know, a bit vulgar. The first thing every student used to say, senior, we are going to the dean's office. What is this dean's office? Every student is going to the dean's office. Then we found out that the gents' restroom was opposite the dean's office. So these people used to say that we are going to the dean's office. And behold, what was written? India's future is in your hands. Shake well before and after use. I'm sorry for the vulgarity. Of course, medicine, as you know, is common sense. Those physicians who have a lot of common sense are very successful. I am sure patients who also have a lot of common sense are successful. Never believe anything for miraculous remedies. So, common sense is extremely important. And that was taught to me by the anatomy peon, a man called Mita Bai. So, in those days, the main examination was to identify the organ under the microscope. See, these slides were there. So they will be displayed in the examination. You go on a turn. I'm sure all of you would know in the colleges. And you go and look under the microscope, try to identify what it is. And we had to find out which organ it is in anatomy. Say kidney, liver, whatever it is. So it was very difficult actually to make out what it is. And not only that, the student in front of you invariably moved the slide so that even if he doesn't know, the next fellow should not know. So it was impossible. Then Mitabai told us, there is no need to look through the microscope. Take the slide out and look. There is a number or there is a mark. You can identify what organ it is. So this is common sense. This has helped me a lot. So never really worry for the actual science. Now, how did I become a nephrologist? Again, third MBBS, I stood first in the Bombay University, both like Madhu said, in medicine, surgery, etc. I was very happy. I said, I'm going to become a cardiologist. Because the head of medicine was the head of cardiology also, Dr. K.G. Nair in those days. Some of you would know. So he was the head of medicine. So I said, I'm going to become a cardiologist. Of course, we didn't know at that time that you can make a lot of money as a cardiologist. There were no angioplasties in those days. But, so I said, I will become a cardiologist. For some unknown reason to me, K.G. Nair decided to retire that year. He resigned. And Dr. Acharya, who was a nephrologist, she became the head of medicine. So automatically, my fate was sealed as a nephrologist. Not that I am anyway repentant, because nephrology, as you see, is a full science. A nephrologist is a physician, for those who don't know, who deals with kidney diseases. The kidneys are made out of microprocessor units called nephrons. So we are physicians treating nephrons. So nephrologist. So that's my story of becoming a nephrologist. So save your kidney. Only you can. Now, why should you save? There are two questions which arises. One is, why should you save at all? Is there a need? There are so many diseases. Why should we worry for kidney diseases? Number two, can you do it? So let's look at it, whether it's possible. Now, you will be surprised that 10 to 12% of the adult population have some impairment of kidney function. This is a great concern all over the world. See, depending on the sensitivity of the test that you do, you can identify that the kidney function is going down in people. And the reason for that is very clear, because there is a very high incidence of diabetes and blood pressure. I am sure if you take here right now amongst the audience, you will find at least every other fellow having high blood pressure. If not, at least 1 in 3. Same way, diabetes will be there at least 1 in 5 or 1 in 10. So diabetes and blood pressure are the biggest culprits leading to kidney disease. So they lead to impairment of kidney function slowly, along with aging. And you find that in the adult population, the normal human growth stops at 20. Actually, what we start is after the degeneration. So you will find that degeneration sets in and the kidney function goes down. The concern is, see, it's okay if somebody gets a disease and disappears. There is no problem. But the problem here is they are going to live long with the disease. So it is going to be an extra expenditure throughout life. And not only that, the quality of life suffers. What I believe in medicine is, whatever we live, we should have a good quality of life. That has been my line of practice right from day one, that medicine should offer somebody a quality of life. There is no point in just pulling or prolonging. So the quality of life gets affected if you have a kidney disease. The treatment cost we have estimated, even if 1% of that impaired kidney function lands up in a situation requiring dialysis or kidney transplantation. That is, this is called end-stage kidney disease. See, the body can adapt very well. Till 90% is damaged, you don't have any symptoms. You can live well, you can be reasonably all right. But small percentage will, once it drops below 10%, you will start having problems. So you cannot sustain life without having dialysis or kidney transplantation. This is called end-stage kidney disease. So if a man gets a kidney failure, lands up on end-stage kidney disease, has kidney transplant, dialysis, we have calculated that the average expenditure is anywhere between 25 to 30 lakhs. No country can afford. This is a problem all over the world. If you see, the Tamil Nadu government last year has spent 160 crores on hemodialysis alone, which is much more than cardiac disease or any other disease put together. So, you find that the expense is enormous. And what is the facility that we have? Very low. We hardly treat 1% of the patients who require treatment. So the number of patients on hemodialysis in the country, now it has gone up. It's about 70 to 80,000. The number of patients who are on peritoneal dialysis, I will explain to you what is this home-based therapy called peritoneal dialysis, is about 7 to 10,000 rupees. Renal transplantation, we do on an average about 5,000 a year. So we can hardly cater to the needs of patients with kidney disease. So what is important then? Can we detect it early? If we detect early, can we prevent it from progressing to a stage requiring dialysis and kidney transplantation? I think this is the ultimate solution where we have to, as a country, detect the disease early and prevent from people landing up on dialysis. In this country, still the word dialysis is like death. The moment I tell a patient you require dialysis, he says, sorry, he's aware of dialysis. See, nephrology, I forgot to tell you, is famous only for two reasons. One, either a VIP gets a kidney failure. You know that. Jayaprakash Narayan got a kidney failure in those days. Everybody became aware of kidney disease, I am sure. Subsequently, of course, there are others like M.G. Ramachandran and others who got kidney failure. And the other thing is always kidney theft, commercial selling of kidneys. So there are only two reasons why nephrology has been popular. But not popular, I mean, people are aware. Now, so what is important is to see that whether we can prevent this unfortunate requirement of dialysis or kidney transplantation. Nephrology is a boring subject. You can pass MBBS without reading nephrology. There is no question asked in nephrology in whole of MBBS. For that matter of fact, you can pass your MD by writing only a short note. You don't have to know much about nephrology. So, it can be very boring. Of course, I have to make it colorful. The only way is adding slides. And Chari has strictly told me that no question answer session. So I cannot have fights. Now, this is over my practice. As I said, I started my practice about 35 years back. So over years, I have heard so many myths about kidney disease. So I will just enumerate some of them and take the lecture from there. So location of kidneys. Even now, some patient will come to my room and say, sir, my kidney is swollen. Obviously, the fellow means the scrotum. So there are still people who do not know where the kidneys are located. We are at that stage, at least some people. So, location of kidneys. There itself there is a problem. And second thing is, sir, how can you say I have a kidney problem? I have no urinary symptoms. I am passing urine normally. I am fine. Why do you say that I have a kidney failure? Just because you have some reports, you are telling me. So, kidney diseases very often do not produce symptoms. I will explain to you a little later why they don't produce symptoms. Kidney disease is irreversible. This is again a misconcept. See, there are basically two types of kidney disease. One is called acute kidney injury. Previously we used to call it acute kidney failure. Now we use the word acute kidney injury. That is, temporarily the kidney does not work. For example, somebody has a normal kidney function today. He has gastroenteritis, loose motions. He gets dehydrated. The blood supply to the kidney goes down. His kidney fails. You give him 1 or 2 dialysis and he recovers. So this is called an acute kidney injury. So kidney disease can be reversible. So don't think that all kidney diseases are irreversible. So we can definitely, so it's very important. This identification from both patients and doctors' viewpoint, I find that even doctors are not aware of it. It's extremely essential to go through the records of the patients carefully. See, just because somebody has diabetes and a raised creatinine does not mean that he has chronic kidney disease and he is irreversible. This is wrong. This is what is happening in practice. Many of the doctors are also doing it, which is wrong. See, you have to identify whether it has recently deteriorated. So if it is recently deteriorated, it can be reversed. So it's very important to go through the history properly, go through the records properly, and decide whether it's an acute kidney injury or a chronic kidney disease. Obviously, the following thing is the same. Dialysis once started has to be permanent. This depends on whether it is a chronic kidney disease or an acute kidney injury. If it's an acute kidney injury, it will reverse. Maybe 1 or 2 dialysis. Actually, what happens is, see, one of the famous stories, I don't know whether you know, in those days, this happened several years back, about 15 years back. There was a patient who went to CMC Vellore. So they did his test and he told him you require only dialysis and kidney transplantation. As luck would have it, that fellow went to Ambur to a gentleman who gave him this Karisalangani Kirai or whatever it is. And the patient anyhow improved. So what he had was an acute kidney injury. It recovered by itself. But for years he used to advertise in TV that Vellore had abandoned and I have treated and this patient has improved. So with that he made a lot of money. I don't know, many of you would know. I don't want to name the person. He used to come on a horse also and show that he has improved kidney function. So it is very important that to identify whether it is acute kidney injury or chronic. Kidney disease is not preventable. Again, it is wrong. Majority of the kidney diseases are preventable. We are not aware. Doctors are not aware. That's all. As I said right in the beginning, at MBBS level itself, there is no exposure to nephrology. So a doctor is practicing without knowing much in nephrology. This is where the problem comes. It's not safe to donate a kidney. I will not go into it. All of you know it is safe. Otherwise, kidney transplantation would not occur. If person can live with single kidney failure. See, the point is, patients will always ask me, sir, I tell him you have a kidney failure, sir. Single kidney failure or double kidney failure? I always wonder, what is this double kidney failure or single? At least the fellow knows there are two kidneys. I'm happy. So, when kidneys fail, the creatinine goes up. It is always both the kidneys are finished. If one kidney is working, he will be normal. He will not even know that he has a kidney failure. So this question of one kidney failure, double kidney failure does not arise. Of course, water should be consumed in large quantities. I'm not going into this. This is a very interesting topic, Several years back, there was an article in Ideyam Pesigiradu saying that if you get up in the morning, drink 5 liters of water, you can get rid of 47 diseases. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All Japanese technology, etc., etc. What is there in water drinking as a Japanese technology? But he said Japanese technology. Whatever it is. Promptly, lot of patients got admitted in Vijaya Hospital with unconsciousness, drowsiness, with fits. Because the body has a particular capacity to get rid of water only. You cannot consume. You have to take water as per thirst. This is a simple rule. You can go into my website, read it. I am not elaborating much. No animal calculates how much water to drink. It drinks according to thirst. And the animal is all right. We don't have to do monitor tests to find out that the animal is all right. So this has been an unfortunate thing happening all over the country. Why it was promoted in the world is, see, lot of people drink soft drinks or other drinks instead of water. So instead, water is always promoted that you should hydrate yourself well, drink sufficient water. So, but doesn't mean that you should take in large quantities at one straw, immediate 5 liters, 4 liters when you get up. Obviously, this question I'm always asked, beer drinking is good for kidneys. I will not elaborate, which is not true. Salt substitutes can be used in kidney patients. There are a number of salt substitutes which are available, which are all potassium-based substances. Actually, in kidney disease, one of the killer is high potassium. So, you should not take salt substitutes if your kidney is impaired. If your kidneys are not impaired, you can definitely take salt substitutes. Tomatoes to be avoided, etc. I will not go into it. Yeah, briefly going back to the location, the kidneys are bean-shaped organ. You can call the other way around also. The bean is kidney-shaped, whatever it is. The kidneys are bean-shaped organ, the size of a fist, weighs about 150 grams, located at the back, the loin. So there are 2 kidneys we have. If you see, each kidney is made up of 1 million microprocessor unit called the nephrons. That's why we are nephrologists. A kidney weighs about 150 grams. The kidneys receive about 25% of the heart's output. The heart's output is approximately 5 liters per minute. So you have 1.25 liters of blood reaching the kidney every minute. That's the perfusion. That is the amount of blood. Obviously, you will realize why it is required once you know the function of the kidneys. So such a large amount of blood passes through the kidney, and about 180 liters of fluid is filtered every day through the kidney. 180 liters, out of which what comes out as urine is only 1.5 to 2 liters. So 178.5 is reprocessed by the nephron. So it is altered and it is reabsorbed. So that's why even when the kidney function drops to 10%, that means even if it is only 18 liters get filtered, still you can pass 1.5 liters. The nephrons can manage to pass 1.5 liters. So if the kidneys go slowly, gets affected slowly, the body can adapt and the urine output does not change. That's why in kidney disease you don't have a change in urine output. So very often it gets missed because it is asymptomatic. So what does the then why do you get symptoms? Okay, let's look at it. From the kidneys, there are two tubes called ureters. They take the urine down to a reservoir called the bladder, urinary bladder. Now, when the bladder gets distended to a particular size, it varies from person to person, maybe about 300 ml, about 250 ml, 500 ml. Somebody can hold till 500 ml. You get a sensation immediately, yes, I have to pass urine. And from there, the brain, the command comes, oh, socially this is not the right place, I can't pass urine. So, once you identify the right place to pass, the body from the brain gives the command, yes, you pass urine. Then the valve opens and you empty the reservoir. So, diseases which involve the ureter, diseases which involve the bladder, the terminal passage called urethra, they produce urinary symptoms. So, they could be infection, there could be a stone, there could be a growth. Anything can produce urinary symptom. Enlarged prostate, especially this audience. You have a gland below the bladder called the prostate gland. This prostate gland enlarges with age. This is normal, physiological. 90% of the men have an enlarged prostate gland. That's why after a particular age, as the gland enlarges, they get up in the night to pass urine. Normally, you don't get up in the night to pass urine. So, diseases of the urinary tract, they produce urinary symptoms, but not the diseases of the kidneys. This is a microprocessor of the nephron. If you take, each kidney has 1 million nephrons. So some of them are born with, see the premature babies now we are concerned. Low birth weight babies we are concerned because they are born with less nephrons. It has been shown that if you are born with less nephrons, in future you are likely to get into kidney failure. You may ask, some people do ask, why should I get? Well, other fellow is not getting. He also has the same diabetes or blood pressure. It may depend on the number of nephrons you have. See, this is the actual test that we do called an IVP or an intravenous urogram. You can see the white marking line, that is the collecting system from the kidney. The ureter gets collected, the two tubes that they go down, and the bladder down, right down, what you see is the bladder. So this is just to show you what is the actual. What I showed you was schematic, this is the actual what is seen in the body. This is an ultrasound, I don't know whether you can see it. You can see an oval shaped structure, that is the kidney. Very simple investigation available through the country to identify tumors, stones. One of the dangers of ultrasound is this. It overdiagnoses kidney stones. You have to realize this. The moment an ultrasound is done, they pick up some small microlith, they will write there is a stone. But see, ultrasound principle is that as the ultrasound passes it, anything that reflects is reported as a stone. So it is not a true stone. So don't believe ultrasound reports as stones. You will find that that is excessively reported all through. So coming back to what is the function of the kidneys? I always ask, immediately people tell me, oh sir, yes, to get rid of the waste products. Absolutely right. See, we eat. People eat different food. One chap eats non-vegetarian, one fellow eats vada, one fellow has this. But if you do the blood test, everybody has the same urea, creatinine, water, everything. So who is doing managing everything? The kidneys. Whatever you eat, whatever the products of metabolism, it is removed by the kidney. Excellent machine which gets rid of it. That's why there has never been a dialysis which is an actual replacement of the kidney. So excretion of waste products. People have different food, but still the body homeostasis or the internal environment is the same. If I take, you may eat whatever you want, but still your water content, your sodium content, potassium content in the blood is all similar. We have ranges. So this is called the internal environment. The internal environment is important for the functioning of each and every cell of the body. So kidney disease, when kidneys get deranged, the function is affected in each and every part of the body. That's why patients with kidney disease have symptoms elsewhere. Somebody may have excessive sleep, somebody may have lack of sleep, somebody may have irritability, somebody may have breathlessness, so many other things which are unconnected. You will say, my symptoms are entirely different and this foolish doctor calls it kidney failure. So, the functioning of the kidney is responsible for the internal environment or the functioning of each and every cell in the body. That's why nephrologists are the good physicians. They are the best physicians. They know about every cell in the body, unlike other specialists who look only at that particular system. So, of course, certain hormones are produced by the kidney, like vitamin D activation, erythropoietin. So the growth is affected if the child has kidney failure, or they become anemic because the bone marrow does not work, etc. As I said, there are two basic types of kidney disease. One is called the acute kidney injury. Normally, the word acute in medicine means anything that is less than, the moment I tell acute, I don't know how people, they think it is very severe. No, the word acute and chronic refers to duration, not to severity. Unfortunately, people, the moment I say acute, sir, it is very, no, it's not. Something which has been present less than 6 weeks is called acute in medicine. Something that has been there for more than 6 months, we call it chronic. In between, what do you call? Of course, it's called subacute. Now, of course, nephrologists are smart. Now they have slightly brought it down. They say that anything more than 3 months itself is chronic, so that they will have more patients. That's a different story. But, so anything less than 6 weeks duration is called acute kidney injury. That means your kidneys have been normal, potentially reversible. The important point of acute kidney disease is potentially reversible. It has to be identified. I have to identify that you have acute kidney disease, that your blood supply to the kidney is reduced, or your kidney is blocked, or some drug. Most important is drug. You have taken a painkiller and your kidney function goes down. You have taken an XBP tablet that has produced a reduction in your kidney function. So if you do an ultrasound, you find that the kidney size is good and only temporary treatment is required and the kidneys recover. So there are several causes for it. Medically, as I said, gastroenteritis is the commonest. Food poisoning. Food poisoning is the commonest one. So many drugs, painkillers, then post-operatively low blood pressure. Somebody gets admitted with a heart attack. He doesn't have a kidney disease. He gets admitted with a heart attack. You hear it immediately. Oh, he's gone into multi-organ failure. What is this multi-organ failure? Blood pressure has crashed. If BP crashes, the blood supply to various organs goes down. The blood supply to the kidney is gone, he stopped passing urine. So it's an acute kidney injury. If I restore the blood supply, the kidney will start working normally. An important point here is, again, both for chronic kidney disease and acute kidney diseases, native medicines. We don't know there are so many remedies available in this country which may contain toxins. So one has to be careful. That's why I said right in the beginning, common sense is important for a patient also, not just the doctor. Don't believe in miraculous remedies and think that you will be all right. So CKD, or what we call chronic kidney disease, anything that is, this word has become now quite popular. I ask nowadays patients, what is their problem? Sir, CKD. So he has been trained. He is aware that there is something called CKD. So, but it's very important to differentiate and identify. So 6 months, anything that is more than 6 months. So if it has been present in the body for long, it becomes progressive, irreversible. The body starts adapting. The kidneys start shrinking. So till 90% of the kidney is damaged, there may be no symptoms. Urine output will be normal, 1.5, 2 liters, everything is okay. And ultimately, suddenly one day he will vomit or become breathless, and then they do the test, they find his creatinine is 10, the man requires dialysis. So you call what is called a end-stage kidney disease, or ESRD. Then he has to live only on dialysis or kidney transplantation. So in children, there are special causes for this. Any child with urinary infection, you cannot ignore. This is very, very important. The first year of life, if you get a urine infection, you have to investigate the urinary tract. They are born with abnormalities in the urinary tract which can lead to kidney failure. Adult group, if you see allergic diseases, what we call glomerulonephritis or nephritis. Toxins. This is where I am very much concerned, is so many remedies that are available in the market. For example, it's very interesting, so many heavy metals are being used. Right in those days, I am sure many of you know about the use of gold by various personalities and getting into kidney failure. The same way, arsenic is used as a treatment to improve the skin pigmentation. One of the side effects of arsenic is pigmentation. So these leukoderma patients take arsenic. In the sense, they don't know that they are taking arsenic, but they believe in some so-called native remedy. And they take it. Oh, if I take this, the pigmentation improves. So it is arsenic. Slowly it will finish the kidneys. Of course, in those days, I always tell my wife, all the Ranis used to do that for Maharaja slowly, so that they won't even know. Ultimately, they take the throne. So arsenic is a slow poison. Then you have mercury. Mercury can produce hair growth. So I get so many IT boys. Nowadays, baldness is a big problem, right, at young age. People by 20, 22, everything is gone. Especially if they have gone to US and come back, you can identify from a distance. This fellow has come back doing his masters. Everything is gone. So the next thing they look at how to improve it. So they try all sorts of remedies. And these remedies contain mercury. And mercury, one of the side effects is hair growth. In those days, it's a very old treatment, even available in medical treatment. Mercury can produce hair growth as a side effect. So this is used by exploited by number of people. We have analyzed it in IIT and shown these remedies contain like this heavy metals, mercury or lead or arsenic. All of them can lead to chronic kidney disease. You will not know at all. One fine day your kidney goes on shrinking and you find you land up on dialysis. You have never not even known that you have a kidney problem. So symptoms, as I said, not much. Unless it's an acute kidney disease where there is a symptom, usually there is no urinary disturbance. But one early sign could be that young people, if they get up in the night to pass urine, normally the kidney has a good concentrating capacity. This is not applicable for elderly, because elderly people, the enlarged prostate makes them get up in the night to pass urine. But for younger people, this is not for tag audience. This is for younger people. If you get up in the night, it is possibly due to a kidney disease. Generalized symptoms, vague symptoms, feeling tiredness, weakness, I don't have the energy, all those things are part of kidney failure, because as I said, every cell in the body is affected with kidney disease. Signs. This is more important. If you have swelling, I am sure the patient will immediately run to the doctor. And the doctor also immediately will look at the kidney. So swelling is usually a good thing. If you get a swelling as a side effect, as a symptom, it is very good. Then you can identify kidney disease early. But not all kidney diseases produce swelling. Same way, more important is blood pressure. This is where I want to emphasize. Blood pressure should never be taken as a disease. Blood pressure is a marker of an underlying disease. Don't take BP as a disease. This is where people do mistakes. I will come to it a little later. So BP, if you have high blood pressure, even detected, you should check for your kidney function. You should check creatinine and urine albumin at least once a year. Then you will not miss kidney disease. So the urine examination. The most important test that we do to pick up kidney disease early is the urine examination. People ignore this. I saw yesterday a patient who he's been having kidney failure for the last 6 months, diagnosed, coming from Calcutta, huge file. 101 tests are done, ultrasound, CT scan, MRI. Basic urine examination is missing. He says it has never been done. So, the first test that should be done is a urine examination. Give importance. See, normally urine does not contain protein. Because as I told you, these nephrons are impermeable to protein. Proteins are present in blood. They don't appear in urine. But when the nephron gets damaged, that means the damage is at microscopic level. The protein starts leaking. So if you find albumin 1+, 2+ in the urine, you know your kidneys are getting affected. Unfortunately, even doctors think that it could be due to urine infection. Urine infection does not produce protein loss in urine. You have to know that. This is a mistake which is done even by doctors. They will say, oh, possibly urine infection. Do a culture. And culture will show growth. Again, this growth is in the laboratory bottle, not in that fellow. And then they give him unnecessarily one antibiotic. After that, they repeat, another laboratory will say there is no albumin. So this fellow is cured. Later he comes with a kidney failure. So most important marker, the most sensitive test is presence of albumin or protein. This is the crux of today's lecture. Is protein leak in urine as a marker of kidney disease. If I am able to get this through to you, I will be very happy. Then of course we have other microscopic examination, blood test. Urea, more than urea is serum creatinine. Serum creatinine again estimates the kidney function. Serum creatinine is not a disease. Patient will come again, I ask him, what is your problem, sir? Raised creatinine, sir. So raised creatinine, it's a marker. It tells you, it just estimates the kidney function. Creatinine is a substance produced by the muscles normally, and that is removed by the kidneys. So when the kidneys don't work, the creatinine in blood starts going up. So you use it as a marker to identify what is the level of kidney function. So there is a big range. For example, between 0.5 to 1.5, you will think the range is as mentioned, so my creatinine is within the normal range. That doesn't mean your kidney function is normal. Because if you do, there are special mathematical formula, what we call EGFR. If we estimate the actual filtration rate through the kidney, for example, creatinine of 1.3 indicates a kidney function of only 60%, whereas a creatinine of 0.8 may indicate 90%. See the difference? 30% loss is there. But this man has not realized. He thinks I am within the normal range, so I don't have a kidney disease. So it's not correct. So creatinine requires a careful interpretation. Ultrasound, of course, all of you know, where you can look at the structure of the kidney, not the function. You will see whether there is a tumor, stone, growth, etc., etc. Then there are special tests like the microscopy kidney biopsy. Very important, as I told you. You look under it, you can identify what is the kidney disease. Now, what can we do once we identify the kidney disease? So, first thing is curative. You have to look whether this is acute kidney disease. If it is chronic kidney disease, has anything produced it? Is it a heavy metal, a drug? What has been the cause? Identify. Do a biopsy. Remove the toxin. The kidney function will come back to normal. So, the first priority is to get back the kidney to normalcy. That is called corrective or curative. But not all patients it is possible to achieve a corrective or curative. So, you go to the conservative line. That means the kidney has already become small. I can't correct it. Now what do? Now I prevent him from landing up on dialysis and kidney transplantation. This is called conservative treatment. Conservative treatment, what we do? We restrict your diet. We tell you, eat less salt. You reduce potassium in the diet. Take water as per thirst. Reduce that, etc. See, 1, 2, 3 myths which I should clarify. Proteins are restricted only for animal proteins, not for vegetarian proteins. Unfortunately, I don't know how this has got into it. The moment I tell a patient that you have a kidney failure, he'll say, sir, I don't eat parpu saapradilla, dal saapradilla. From where it has come, I don't know, but it has got ingrained into the brain that if you have a kidney failure, you should not eat dal or protein. Vegetarian proteins are not restricted. It has been well studied that vegetarian proteins do not harm the kidney disease. So it's only animal proteins. Protein restriction has a value in people who ate steak and such things, who take 100 grams of proteins, one bite. Whereas the vegetarian fellow with difficulty manages 40 to 50 grams. If you stop that, you will go into malnutrition. So you should not. Of course, diet is very useful. I should tell about diet, Should never tell a patient, first thing in practice you have to realize, never tell a patient that eat a normal diet. I think that's one of the biggest sins. See, this you have to learn from the people of alternate medicine, homeopathy, Ayurveda and all. They will restrict so many things. Tomorrow when the fellow comes with no improvement, you can say, yeah, you did not restrict the diet. That's why you are in trouble. So it is very useful. So never tell the fellow that eat a normal diet. Number 2, when you restrict the diet and tell him, next time he comes, the creatinine is gone up a little high. No, you don't know what to do. You are worried. So you look at it. The wife immediately comes to your rescue. Sir, na appave chonne avarta bonda chaapadango, bhaji chaapadango, nu saaptutta adan creatinine eriduthu. So your problem is solved. So never allow a fellow to eat normal diet. Always restrict. But jokes apart, what you require basically is to reduce the load, working load to the kidney. That's all. What you are doing by restricting diet is reducing the workload to the kidney, preventing complications. What can kill in kidney failure? If you take excess salt, water will accumulate, you can become breathless, lungs can get flooded, you can land up in trouble. So, reduce salt, reduce water. Don't take water, take water as per thirst. You don't have to take very less water also, otherwise you will get dehydrated. Potassium, this is more important. See, people don't realize. If you take high potassium, say uncooked food or juices, coconut water, coconut water is a miraculous drink. It has so much of potassium. And the potassium content of coconut water cannot be estimated. I cannot say uniformly this is the potassium content. It depends on the soil from which the coconut trees grow. So you find that it could be anywhere from 20 milliequivalents. Some of you may know chemistry. So from 20 milliequivalents to 100 milliequivalents per liter. So which can be enormous, phenomenal. So nobody can really tell you, but it contains very high potassium. It's a good drink normally if your kidney function is good. But if your kidney function is impaired, the first thing, again, I learned a lesson right in 1983. So I was an assistant professor in KM Hospital in Mumbai, and my classmate, I think R.V. Rajan is here, you would know probably. He's called Swaminathan, Chama, different Chama, not V. Swaminathan. This man, his father got a stroke and he had a kidney problem. So he got admitted in KM Hospital. So I was treating him. So I just admitted him, examined him. We collected the blood sample for this thing. So I came after half an hour. That fellow was dead, the old man. And my classmate comes with 2 coconut waters in hand. Not realizing that he had given the coconut water. That potassium was already 6 and this fellow had given him 2 coconut water. So after that I made it a policy. The first thing I see a kidney patient, I tell him don't drink coconut water. Then you come with the reports. Very important. This is where potassium can kill. It can make the heart go slow. We are always worried of potassium in kidney failure. So the restriction in diet is for controlling the complications. Of course, you may still reach a stage, as I said, small percentage, requiring dialysis or kidney transplantation. There are two types of dialysis. Dialysis means it's an exchange across a semi-permeable membrane. So you have a chemical reaction. I'm sure a lot of you know dialysis, the word. It's from the Greek word. Now to separate, it means to separate. So peritoneal dialysis, where the peritoneum is a lining surrounding our intestines and stomach. It is inside the abdomen. So this is called peritoneum. It is about 1.5 to 2 square meter. That is the size of peritoneum. So big it is. And that is called the peritoneum. That is used as a membrane in peritoneal dialysis. I'll show you how it is done. This is getting very popular. And you have the hemodialysis. Hemodialysis is where you take the blood out, you purify it and send it back to the patient. So this is called the peritoneal dialysis. A tube is put inside the peritoneal cavity. So what you do is you put in 2 liters of solution inside, leave it for 4 hours or 6 hours. Afterwards you again empty it. So the exchange occurs across the peritoneal membrane between the blood and the chemical solution. The urea, all potassium, bioacid, everything gets out. And then you remove it. You do 3 times a day. Half an hour it lasts. So you can do it as per your convenience. You can do in the night, you can do whenever you want, you can go to the office. I have so many of my patients who go to their office, you will not even know that he is on peritoneal dialysis. They do it at home, they just report to me once a month. This is called CAPD or peritoneal dialysis. So you can be very comfortable with that and you can do normal work 7 days a week. This is called peritoneal dialysis. See, this is how it looks. You can wear your pant. On top of it, your dress. Of course, you can cover it before you go to the office. Yeah, this is what it's a tube, small tube which hangs. Nothing more. People even travel. You can go on a boat. People go on a cruise. You can carry your bags with it and you can dialyze yourself. You don't have to restrict yourself for anything. This is very getting popular. In India, we have about 10,000 patients. I have about 200 plus patients and I promote it very actively by doing the assist program, which I will come a little later. So this is called chronic ambulatory. Ambulatory means somebody is walking. Peritoneal dialysis. This is the traditional hemodialysis. You have a machine, you make the patient go to the hospital, he lies down for 4 hours, 2 times a week, 3 times a week, the blood is withdrawn, punctured, and then it passes through an artificial dialyzer, and then a dialyzer, which is called an artificial kidney, and then it is returned back to the patient. So this is called the traditional hemodialysis. I am sure all of you know, which is very popular because one reason why it is popular is the doctors and hospitals get incentives out of it. Whereas in peritoneal dialysis, there is no incentive for anybody. Everything revolves around commerce. I am sure all of you know. So this is the access, what we call, where we puncture the vein. We have to develop, we connect the artery and vein inside so that you can withdraw blood at 200 to 300 ml per minute. That's the speed with which I have to take the blood through the machine for purifying it. This is the close-up of the artificial kidney or the dialyzer, actual dialyzer. It's a semi-permeable membrane made out of various substances. So with that, I will just move to the next topic a little, which I think has great. If Chari gives me a chance, maybe next time I'll talk on hypertension itself. Because hypertension is a huge topic. You can talk for hours on hypertension. The biggest killer, the number, if I ask you which is the commonest disease in this population, high blood pressure. If you ask which is the commonest disease in the world, high blood pressure. Which is the disease which leads to maximum deaths? High blood pressure. So everything is high blood pressure. So the story of recording blood pressure is interesting. How did it come? It's very, I should say, I won't say cruel, but see the way the first blood pressure was recorded was by Stephen. What he did was, he cut the artery in a horse and he used a scale to measure how high does it go. That's how blood pressure was first studied. And he said this, as the animal dies, the blood pressure drops. So it disappears. Obviously at the end there is no blood pressure. So he was bleeding animals to record blood pressure. That's how the history of blood pressure. From there, of course, we have come to a way where we have very simple techniques to... And of course, it also follows. I'm sure some of you who have attended my lecture before would know, which is the animal which has the highest blood pressure. No, no, no. Don't answer. Those who have attended my lecture should not answer. Giraffe. Because it has the longest neck. The heart has to pump that much of blood. So you can understand to that height. So it has the highest blood pressure. So you people with long necks, be careful. You may have high blood pressure. So how do we diagnose blood pressure? Now to diagnose blood pressure is again a big problem. I'm sure all of you, sir, people are totally confused. Commonest disease, but still so many confusions. How do I know I have high blood pressure or not? The simplest question. Now, the definition is this. If on 2 readings in a comfortable, peaceful atmosphere, if you can record a blood pressure of more than 140/90 on 2 days or 2 readings, then you call it hypertension. Now you have to have a very comfortable environment in a sitting position, so many things. People don't understand that. You know, there was a study which we did in KM hospital long back, and that we said we were, I think we were foolish. We thought we will record the blood pressure, the best bet is to catch the railway station. Somebody must have seen Bombay railway station. Fellows come like exodus from the train, and another group will go into the train. So we were 5 of us from the KM hospital sitting with the BP apparatus trying to record blood pressure in the railway station. More than 50% had high blood pressure. Every fellow was running to the... so that study was so flawed. So the definition of blood pressure is it has to be in a relaxed atmosphere. Doesn't mean that it has to be a clinic. You have to remember this. See, I still have patients who tell me, sir, நீங்க measure பண்ணாதான் எங்களுக்கு சந்தோஷம். I tell him, if I measure it will be wrong. You have to measure yourself at home. Ultimately, it is like what I told Sundaram Mama. There is no point in admitting him to the hospital and controlling his sugar. He has to control his sugar at home, in his environment, in his food, with his exercise. There is no point in putting him inside and cut all his food and give him insulin and bring it down. That's not the way that medicine works. Same thing for blood pressure. So, what is the definition? So we now, of course, have expanded it and we say between 130 to 140 or 80 to 90, we call it pre-hypertension. That means you have to watch. You may get hypertension tomorrow. I'm not going into the details, how to treat and all. You can go into our website. We have tips to control blood pressure. The books today, the books we have distributed again, is a copy of our website. You can go into our website. So blood pressure leads to strokes, heart attack, and kidney failure. That's why it is the number 1 killer in the world. Now if you see the world, the WHO figures, countries have anywhere between 20 to 50% of the adult population having high blood pressure. India is somewhere in between, about 35%. Around 35% of the adults in India have high blood pressure. The African countries are the lowest. I'll come to it why. Some South American countries are the highest. Somebody can guess why? The next one will tell you. Yeah, before that, yeah. The reason is the salt intake. So people, the commonest cause of blood pressure, if I ask, the moment I ask any crowd, they will say stress. No, it's not stress. See, stress and all, it has been shown very well that the blood pressure shoots, but it drops. And not only that, it has been shown very well by various methods to de-stress, whether it is yoga, meditation, or other forms of therapy, etc. The drop in blood pressure is not very much. It's only 2 to 5 millimeters that it can drop. The single most important factor which is responsible for high blood pressure is salt intake. So that's why you have the Africans who consume the lowest salt have around 20% incidence, whereas it goes higher as South Americans consume very high salt. Now, who should treat blood pressure? This is always a question. Now, in the medical textbook, unfortunately, blood pressure falls under cardiology. So, the cardiologists traditionally have been treating blood pressure. But I am sorry to say that it is not really, I don't appreciate it because, see, blood pressure is a marker of kidney disease. 1. So, 2, kidney disease produces blood pressure. Both are so closely related. The body, there is a hormone produced by the kidney called renin. That is responsible for your blood pressure. The kidney is responsible for getting rid of the salt that you take. So the kidney is responsible for blood pressure. High blood pressure damages kidney. Kidney disease produces high. So they are so intricately connected that if you are undergoing all tests, including echocardiogram, treadmill and all, but forgetting simple creatinine and a urine albumin, this fellow unfortunately lands with a kidney failure at a later stage. So this has been traditionally happening all over the world, because in medical textbooks, blood pressure has always been under the topic of cardiology. So cardiologists have always had the upper hand in treating blood pressure. But I think nephrologists should take over. Of course, it's not just nephrologists. I think every physician should know to treat blood pressure. Blood pressure is such a common disease. If you say 1 in 3 population has it and you say, I don't know to treat, means you are not a physician. Such a common disease, you have to know in and out to treat. So no physician should, for that matter of fact, a patient himself should know what he should do if he has blood pressure. So ultimately the responsibility drops to the patient to control his blood pressure. Now, how should we measure this blood pressure? Again, there is a confusion. People think clinic blood pressure is the best, which is wrong. Clinic blood pressure is the lowest sensitivity. You have what is called white coat hypertension. Some patients will tell me, sir, BP shoot arudu. We had a chap called Shyam, I still remember, and he was to donate kidney to his mother in those days. He did it in 1980s. So he's a young boy. He was only about 25, and he was donating kidney to his mother. And I recorded his blood pressure. It is normal. The nurse recorded it was 180 by 110. Every time the nurse recorded it was 180 by 110. Whereas I recorded it was normal. Shyam is still doing well. He's in Detroit. His blood pressures are normal. So clinic hypertension, clinic blood pressure does not mean it is normal. So what is next is, the most important now what we are promoting is home monitoring of blood pressure. So don't think that I don't have the mercury manometer. See, the mercury manometer is banned all over in the world. Except in India, it is not available anywhere in the world. You know, mercury is an environmental toxin. Nobody is allowed to handle it. I don't know for what reason, still it is available in India, it is continuing, mercury manometers. And patients have so much faith in it, and old doctors also have so much faith in it. It still goes on, the mercury manometer. So the mercury manometer is no longer required. Digital blood pressure apparatus are reasonably alright. Don't think they are wrong. So some of them may require calibration, but I am sure, actually, you should monitor your blood pressure at home. So that is the best way all over the world it has been shown that you can control your blood pressure. For that matter of fact, now anybody who gets any function, I have stopped giving other gifts. I give them one BP apparatus. Salt and blood pressure. See, the WHO recommends that we should take only 5 grams of salt. Whereas in the Indian salt intake is extremely high. We take anywhere between 10 to 15 grams. That's the average Indian salt intake. But actually there are not many studies. There are 2-3 studies. One study from Andhra, I am sure you will not be surprised. It was not a very good study, a little flawed. What they did was they went home to home, found out what is the average monthly salt consumption, divided by the number of people. They came to a figure of 40 grams. But I am sure Andhra people are taking more salt than the average 10 to 15. But salt intake, people don't realize. Salt intake is the most important cause. The WHO's recommendation is 5 grams. 5 grams of salt is what? 1 teaspoon of salt. That's all. It's nothing at all. Absolutely less. And studies from India, actually if you have to test correctly, we have to do your 24 hours urine sodium. Then I will know how much salt you have taken. See, invariably patients don't tell the truth. They will eat, they will say, I don't take salt at all. And then they will go and eat pickles. That is all not included in the list. I tell them, see, I am not an income tax fellow. Don't give me 2 accounts. Give me only 1 account. I know you fellow write another book. That's a different issue. So tell me the correct salt intake. So the salt intake has to be reduced more in children. This is very interesting. See, you would think, unfortunately, I have seen mothers and parents encouraging children to have salt. Poor fellow is finished. Actually, the other way around, I will say, see, when I passed my MBBS, as I told you, my first patient was a party. She was 95 years of age. So I think J. Jayaraman is not here. His mother. So she was 95 years of age. And he said, please come and see, you have passed, you have got gold medal and all. You have to treat my mother. So I went. She was 95 years and the party was in tears. She was crying, not talking to anybody. So I went to party and asked what it is. She said, I have a pacemaker. I have diabetes. These people are not allowing me to eat salt or sugar. So I am just crying in a thing. So I said, first thing you eat, both. At your age, there is no exemption. First thing you will eat both. Get the payasam right now, eat it. She continued to tell for the next 4 years, Ravi is the best doctor. So very important. So you should know where to restrict. Children, very important. I think I am going late, but see, so reduced salt definitely lowers blood pressure. I will not go into it further. So there are several issues now all over the world. They are passing legislations that every food packet should contain the sodium content mentioned. And low salt substitutes should be available. For example, if you have a cheese, you have to have an equivalent cheese at a low salt. And the consumer should be given the choice to buy X or Y. So the salt intake all over the world, there is legislation that has been passed in US, it has been passed New York, recently they passed, it has already been passed in UK, so several countries, it's an issue. Of course, I will not go into this detail how in US they control it. Doesn't matter who records the blood pressure. The best way to control a man's blood pressure was through the barber. The barber acted as a physician. So every month, whether the person has a hair or not, he goes to the salon. Sometimes it's difficult to cut. But that fellow records the blood pressure and he finds that the blood pressure is high. He refers him to the hospital. So this way they found that those people who underwent this barber shop monitoring had a better control as compared to those people who are going to doctors. This was a study, famous study, which was published a couple of years back. This is the foundation. See, again, a brief introduction. In 1997, I started the Balaji Medical Educational Trust. See, one of the problems that I face in private practice is that halfway through treatment, patient says, sir, I don't have money. What do I do now? I send him to government hospital. The government hospital doctor is very angry on me. He says he has fleeced all the money. Now he has pushed the patient to me. So he is not happy with it. So, and the treatment also is a problem. The hospital management says you discharge him. What do you do? So you are in a situation and you have some emotional attachment to patient. What do you do? I can't abandon him halfway through treatment. So one of my patients, she gave me the first idea in 1997 and she gave the first corpus of 3 lakhs and I founded the Balaji Medical Education Trust. The first idea initially was to help patients with treatment. So whenever somebody used to be in trouble halfway through treatment, I used to subsidize them. For example, I still remember a lady I had cut down. She came to me about a year back and she said, my son has, she lost her husband. She said, my husband was your patient, but he died. I said, I'm very happy still you are seeing me. But she said, no. The point is, my son has now passed. I mean, he's working. I want to give the first pay to your trust. You may not remember, but in those days when dialysis were 500 rupees, you made it 450, you gave a concession of 50 rupees. So this was in 1980s. So she remembers still that, and she was remembered. So the foundation, we started to help patients through this thing. Subsequently, I realized it's just helping patients is not enough. Subsidizing treatment, dialysis, etc. So what we do is we took up preventive healthcare. We had plans of setting up a kidney hospital, but the cost of land and the project cost went so high that I abandoned it. And again, I thought that it will help only a group of patients. To help the mass, we have to get into prevention. So now our priority is prevention. I give a lot of preventive lectures and I'll tell you certain projects we have for prevention. So this is a trust started by my own patients who gave the donation. It is run by my own patients and it is used for my own patients. We have today Ramachandran and Kannan. They are both in my foundation. Ramachandran had a kidney transplantation in 1992 and Kannan had it in 1991. They are still with me and they have been very helping all the patients. They are aware of the problems and they are very considerate. Of course, as I told you, the awareness lectures I give all over various places, Rotary clubs, Lions clubs, etc. Here, Chari has said, no question answer, but that's the best part usually. And in the Raj Bhavan, when I spoke, the maximum questions were asked by the governor, Ram Mohan Rao. He had an enlarged prostate. He did not have a kidney disease, but he asked me the maximum number of questions. The Japanese people are the world leaders in prevention. See, they had the maximum number of patients on dialysis about 20 years back. Then they had, due to a disease called IgA nephropathy, which an allergic disease which damages the kidney. Then they had a program. They said that every year, every child in the school will have a urine examination for protein and RBC. After that, they started screening every child and they started treating. With that, now they have the lowest incidence of dialysis in the world. Unfortunately, India has the highest IgA nephropathy in the world now. So these are the Japanese people who came to us to help us to start the program. Of course, the US consular who launched the early disease program, where we said that you should not only detect, you should advise and monitor. All three are important. Otherwise, you lose track of these patients. We launched the website, sugarbp.org. I chose the word because in India, if I ask him, do you have diabetes? He says, no, sir. You have sugar? Yes, sir. So, sugar. If I tell him you have hypertension, what is hypertension? BP? BP irukku, sir. So, put sugarbp.org. So, you can go into this website. You will get all the things that I mentioned. Tips about to control your blood pressure, tips to control diabetes, and something about weight, obesity, waist-hip ratio, and urinary tract infection, how much water to consume, what is the diet you should have. Everything is covered in this exhaustive website. It is in different languages. You can read that. Of course, one of the biggest problems that we face, I'm sure all of you are aware. See, the moment the patient comes, I tell them, you do this test. Sir, last week da na inga padne, sir. I know you have done it last week. I also don't want you to spend. But he thinks we are going to get some kickback from lab. It's not so. The laboratories are not standardized. Unfortunately, one lab will give a creatinine of 1.4, another one fellow will give 0.8. What do I believe? So there is lack of standardization of blood tests in this country. This is a big issue. We have been trying to fight this. We have been writing to the central government. He is the International Society of Nephrology president. With him, I brought and launched this program of standardization of creatinine through the country. We should have the same creatinine all over the country. Then the question of repeating doesn't arise. How do I believe a report from somebody from Tambaram comes and says creatinine is 8, and whereas it is only 1? Unnecessarily, we have diagnosed a kidney failure, or the other way around it can happen. So the laboratories, mushrooming laboratories, because the money spinner for the lab is the lab in medicine, diagnostics. Not treatment. Treatment is always a problem. You can have two opinions. Whereas in investigation, you always make money. Then the margin is very high. So there are so many laboratories through the country. Salt March. Crazy Mon is here. We had it in the Marina Beach. We told people, eat less salt, eat less salt. Salt is a poison. Salt satyagraha, etc. Cut salt, cut your medical bills. Low salt, the best insurance, etc. We had all slogans. This is a salt march again at Puducherry. We conduct it in various parts of the Tamil Nadu. We had one in Trichy. This is every year we celebrate the World Kidney Day. So we have different themes for World Kidney Day. And one of the World Kidney Day in 2011 was we launched on early detection of kidney disease by the self-detection kit. This is a unique concept. You know, for sugars you can do it at home. For pregnancy you can detect it at home. So for kidney disease, you don't have it. So we got this strip where you dip it in urine for a minute, look at it, you can identify whether you are having a protein or not. Today we have about 150 samples. We'll distribute it. We give it throughout. We have conducted large studies in colleges. I published it in the US, presented it in the US also. It's been well received. It's a unique concept in the world. So the self-detection kit, this is the kit actually. Some of you can take it. We have brought about 150. While going you can collect it. So you just dip it. You have a color strip. You dip it in urine and then you can take a reading of your urine albumin. Of course, added bonus is urine sugar. This is a rare disease which we launched a foundation. We treat, this is the 11th foundation in the world called the cystinosis. It's a rare disease affecting children, producing growth retardation. And we have quite a few children registered with us. We sponsor that treatment, get the drugs from abroad, etc. I will not go into it. It has no great relevance to you. The acute kidney injury. This thing was in 2013, the World Kidney Day theme was acute kidney injury. That how to prevent sudden worsening of kidney function, what to look out for, what drugs to avoid, if you get it, what do you do, etc. This was acute kidney injury. 2014, this has relevance to you. Quite a few of you have attended. Aging and kidney. What happens with age to kidneys? This we had in 2015. I think Madan, Crazy Mohan and all, Shanta was there. So the kidneys age like you. Don't think that the kidneys are young. As you grow old, kidneys are also age. So you better know how to take care of you. I think there is some relevance to this today's audience with the tag, this is the right talk. Now the WHO statistics says that aging population has increased all over the world. Obviously, two reasons, you know that. Longevity has gone up. People live much longer. What we had longevity of at independence of 28 is now 70 plus. US and all, it is 80 plus, it's reaching. And the younger population are not fertile. This is another issue, big issue. I'm sure all of you know there are so many sterility clinics all over the country. So you find this is a big problem. Whatever reason, I'm not going into that, why you have infertility or sterility, but this is a big problem now. So you find the population in large is elderly. So we are concerned of how to handle people who are aged. So what happens to the kidney with age? It starts shrinking. It loses its weight by 25%. So if it is 150 grams, it's down by 25 grams, 25%. It starts forming cysts. See, all of you, still I get a lot of consultation. People come to me, I have a cyst. They think it's malignancy or anything like that. These are benign conditions. With age, you get fluid-filled spaces in the kidney called cysts. So a lot of people have cysts in the kidney. Doesn't mean that it is a disease. Of course, there is a disease called polycystic kidney, which runs in family, which can produce kidney failure. That's a different condition. But people with age can form small cysts in the kidney. So these are the changes. Microscopically, when you see, again, like a scarring, the nephrons get diminished in number. So obviously your kidney function goes down every year. You have to realize that. Your creatinine may be normal. Still, your kidney function is down every year by 1%. And this starts at the age of 40 itself. So every year you are losing 1% of your kidney function, even if you don't have any disease. So theoretically, by 90, your kidney function is very low. So you are losing your kidney function. If you have other diseases along with it, like diabetes or blood pressure, this aging is faster. So how do we estimate? You have certain formula. You have to take into account the person's body weight. You have to take into account the serum creatinine. And there are mathematical formulas. I don't expect you to remember this formula because even my nephrology students don't remember. They just look at it. Nowadays everything is on the cell phone. The moment I tell him, sir, creatinine is this much, what is it? He will just say, sir, it is 28%. Nobody remembers all this. We used to remember all complicated formula. When I passed my MBBS, I used to remember. Now I don't remember also. There is no need. So coming to salt. So again, you have to reduce salt as you age. Of course, this is, if you want to have a comfortable life, that's a different issue. So you have to, that is because the ability of the kidney to excrete the sodium is less. So you have to keep it to less than 5 grams. So my general thumb of rule is that what I tell them is don't add extra salt. First thing is do is whatever is there in the cooking, even if the person has cooked with low salt, be happy about it. Don't ask for extra salt. That is asking for trouble. So don't do that. Whatever salt is there, please accept it. Number 2, we have been trying to tell all the hotel owners, restaurants, that please don't keep this salt and pepper shaker on the table. See, if fellow gets a soup, whether he requires or not, first thing he will do is he will sprinkle. He has not even tasted it. He doesn't even know whether it has salt or not. First thing, kalas. And then what are we doing? So first, please don't keep this salt shakers and pepper shakers on the table. If they ask for it, they are asking for their trouble. That is this problem. But you don't provide the problem. Or we have to have a tie-up. One of the two. So please reduce the salt. So the decreased concentrating capacity. This is important. As I told you, see, the body has an excellent concentrating capacity. You will wonder, one fellow drinks 1 liter. One fellow drinks 4 liters. But still, if I do all the blood tests, it is the same. How does it achieve? That is the function of the kidney. The kidney can get rid of anywhere between 500 ml to 10 liters of water per day. That is the ability of the kidney. That is called the normal concentrating and diluting capacity. The desert rat does not drink water at all. It passes urine only once in 4 days. It does not pass urine. So the kidney can adjust itself. So don't try to challenge it. But with age, your ability to concentrate urine goes down. So you require more water as you grow older. This is again a point that you require to take more water to feel healthy as you grow old. Potassium. Again, as I said, the reverse. See, if your kidney function is impaired, you have to be careful of potassium. If your kidney function is normal, you require more potassium, actually. And potassium basically is present in fruits, juices, coconut water, etc. So you have to make certain. See, it's very difficult. The point is, we can't make generalized statement because nobody has assessed your kidney function. So how do you know what you should do? So normally the thumb of the rule is, don't be a fad. Don't go on saying that I will eat only juices. I will do only this. Don't do all that. Try to eat a balanced diet. So your diet should contain sufficient fruits, sufficient vegetables, protein intake, sufficient carbohydrate intake. Everything should be balanced. Milk products. Actually, the typical South Indian thali is reasonably balanced, except for wheat. What is missing in hotels nowadays provide you with 2 puris or chapatis. So I think the South Indian vegetarian thali is a balanced diet. There is no great balancing required. You have vegetables, you have the fruit, you have the curd, you have the milk product, you have the rice, you have the wheat, you have pulses, you have everything. What more you want? So message that day we gave for the World Kidney Day 2014 was, kidneys do age. Drug doses. This I didn't cover. See, one of the functions of the kidney is not just to get rid of the waste product. The drug that you eat is also removed by the kidney. Whatever drug you take, that's why in kidney disease you have to be careful with the usage of drugs. The dosage requires modification. You can't take the same dose if your kidney is impaired. And that's why kidneys get damaged because of drugs. Because the drugs have to pass through the kidneys. So if you are taking drugs for long, check your creatinine or urine albumin at least once a year. So the drug dosages require adjustment with age, salt intake to be reduced, water intake to be increased, sufficient potassium. I'm not taking excess potassium, sufficient potassium. And be careful of the tests of kidney function. This is where people should have to realize that standardization is important, and 2 important tests are serum creatinine and urinary protein. This is the PD Assist program we launched. This is in 2015, I say. See, what we do is, if you take I told you, peritoneal dialysis, you can do at home. So all over the country, you find there are a number of dialysis units. You see, Lions Club, Rotary Club, we have subsidized hemodialysis. The moment I tell my patients, sir, I become all right, I want to put a dialysis machine to help your poor patients. Then you are doing more harm. Don't do all this. What are you doing by putting these units? All these places, they subsidize dialysis by reusing all the material. The dialyzer, tubing, everything is reused. If I have to dialyze at 400, 500 rupees, I am reusing the material. So you will transmit more disease. See, one of the basic principles in medicine is do no harm, whether you can do good or not. So I cannot create a new disease by dialyzing you. So this so-called subsidized hemodialysis is a very dangerous thing. I went to Bombay, that fellow asked me to inaugurate and talk on subsidized dialysis in Shanmugananda Sabha. After hearing my talk, he felt very bad. This fellow is against dialysis. I'm sure Shankar is not here. So that's what happened. So they compromise on everything in hemodialysis. Basically, the cost of hemodialysis is due to the equipment, the tubing and the dialyzer. What they do is they reuse it several times. 5 times, 10 times, they chemically sterilize it. See, in those days, people were accepting reuse of needles and syringes. Now will anybody accept? You tell me. This part of this country, will anybody, even a villager, will not accept somebody boiling the syringe and injecting him again. Nobody will accept. The same thing for dialysis. Why should we accept reuse of dialysis? We are doing it for cost. So we have to look at a proper solution for it, not try to produce problems. But people don't understand. They want to donate machines and start such dialysis units. So the answer I thought was to promote a home-based therapy, that is peritoneal dialysis. In peritoneal dialysis, what the fellow does in US, the same thing he does here. There is no difference. Charity does not mean compromise in quality. So he does the same thing what he does in India or US. He is back to work for 7 days a week. He comes to the hospital only once a month. What is the hitch then? Hitch is 2. The cost is 20 to 25,000 a month. So how do we handle this? See, hemodialysis also, although you may say I am doing it for 500 rupees per dialysis, in a month the expense is only 5,000. He has to go with another attendant. He has to go by auto. That auto fellow will charge more than dialysis. And then after a dialysis, this fellow cannot walk. He is not going for work. He becomes unproductive. Whereas in peritoneal dialysis, so I said you make it subsidized, and the trust will sponsor 50%. So what we do is we give half the cost. We ask the patient to bear half the cost. Ask the company which manufactures the solution to reduce the cost. So then you are back on your, for 7,000 to 10,000 a month, you are back. You can work 7 days a week. You can earn that money and still you are at home. And you get the treatment what you would get in US. So this was called the PD Assist program. This is a unique for the first time in the world. And we have patients now, not only in Chennai, I have some patients in Mumbai and in Calcutta. We are still sponsoring. Chari is getting up, so I think my time is over. So the World Kidney Day 2015, we still have the Tamil street play, which is still going on. And I'll just put a brief, no? It doesn't come?
கேட்குறது எவ்வளோ சந்தோஷமாக இருக்குது. ஒவ்வொரு மனுஷனும் காலையில் எந்திரிச்ச உடனே பல்ல விளக்கிட்டு அப்படியே கழிவறைக்கு போய் காலை கடனெல்லாம் முடிச்சுட்டு ஒரு காஃபியை குடிச்சிட்டு அப்படியே ஒரு வாக்கிங் போயிட்டு குளிச்சுட்டு இதை மாதிரி ஒரு ட்ரெஸ்ஸை போட்டுட்டு வந்து அப்படியே சாமியை கும்பிட்டா எவ்வளோ சந்தோஷமாக இருக்கும். அதே மாதிரி தான் நானும் வந்திருக்கு, போய் சாமியை கும்பிட்றேன். முருகா, அருவமும் உருவமாகி அனாதையாய் பலவாய் ஒன்றாய் பிம்மமாய் இன்றஜோதி புலமுதோர் மேனியாக கருணைகூர் முகங்களாரும் கரங்கள் 12 கொண்டே ஒரு திரு முருகன் வந்தால் உதித்தல் உலகம் மொய்ய. ஐயா முருகா, ஞான பண்டிதா, நீதாயா இந்த ஊரையும் இந்த ஊர் ஜனங்களையும் மக்களையும் என்னை நல்லபடியாக காப்பாத்தனையா. விநாயகா சிவாய நோடாய் ஆறாவ சிவாய நோவென்று சிந்தித்திருப்போருக்கு அபாயம் ஒரு என்ன 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 சொல்லி கூப்பிட்டானே?
என்ன டேட் கால் நெஞ்சி சங்கரா சங்கரா கூப்பிட்டு
அப்பனை போய் டேப் போட்டு கூப்பிட்டு இருக்கா? அப்பான்னு கூப்பிட்றா?
என்ன டேட் காலேஜ் படிச்சுட்டு இருக்க, அப்பான்னு கூப்பிட்டா அசிங்கமா இருக்காது எனக்கு. டேட்னு கூப்பிட்டா தான் அது ஒரு கொஞ்சம் ஃபேன்சியா இருக்கும். எல்கேஜி படிக்கிற பசங்களே இப்போ டேடி மம்மின்னு கூப்பிடுது. என்ன நீ?
ஓஹோ, அப்போ படிச்சுட்டா அப்புறம் டேப் போட்டு தான் கூப்பிடணுமா? அப்பா நான் தமிழ்நாட்டில் இருக்கு அப்பா, அதான் என்ன டேப் போட வேணாம்,
அவங்க ஓடுறத அப்படி.
So these are street plays which is sponsored. See, the theme for 2015 was kidney health for all, irrespective of the economic status. So we decided that we will enact these street plays with the help of Nalamdana. We have been conducting it in all the slums in and around Chennai. And now we have gone to the Mofussil also. So it's about an 1 hour humorous play. And in that they give about 10 tips to take care of your kidneys. And the most important, of course, is to reduce the salt, etc. We have the tips. So these plays are actively still going on. And we fortunately have been getting some sponsors. If Chari allows us, we will do it here also. The next year was kidney disease in children. Children also, as I said, there are certain important conditions which can produce kidney failure. They are all preventable. And one is called reflux. The urine, instead of going down, goes back to the kidney. That damages the kidney. So if you have urine infection in a child, never ignore it. Immediately. And in a child, to diagnose urine infection is difficult because child will not complain. say newborn child or another child will be only crying, and you have fever and more change in just the frequency, number of times, etc. Unfortunately, even doctors miss. So if you get a urine infection, there is no point in just treating with antibiotic. You have to identify there is a problem inside and treat to prevent kidney failure. Same way IgA nephropathy, which I said Japan is testing the urine even now, every year for a child. This should come in India if you want to prevent this disease. Lifestyle changes are required in children now. We found that in Guru Nanak College and school we went, even in children, the obesity is now 15% of the children are obese. And about 6% have hypertension, high blood pressure. So you have to watch out with the change in the communication skills and people on the iPhone and all other things. There is lack of physical activities, exercise. This is a normal X-ray which we show that the urine, if you opacify the bladder, the urine goes down. But it goes back to the kidney in these children. This is called reflux. So, ending my talk, the tips to protect your kidneys: reduce your salt intake, eat a balanced diet, exercise 30 minutes at least, stop smoking. I've not discussed much about alcohol because alcohol is always controversial. Everybody likes to drink. So the medical world also goes on producing papers saying that alcohol is good for this, good for that. But I have not yet to see a single paper which says smoking is good for health. But alcohol, there are always, the lobby is so strong, especially the European lobby, they will promote so much of wine. But one paper which has always remained undisputed is that alcohol leads to increased incidence of cancers. That has been really established. But other organs, heart, cardiologists always promote alcohol drinking. Avoid over-the-counter medicines. This is a big problem. I won't say, see, the point is on the long-term basis, on a regular basis. I won't say, see, for example, in this country, we don't have healthcare system. What will a poor man do? You tell me. See, he cannot go to a doctor, pay a consultation. The best fellow doctor for him is the chemist. He will go, sir, loose motion. Inda pa, eduthuko. Talavali, inda eduthuko. Oru tablet cut panni tharuvan. So his problem is solved, consultation fees is avoided, and he is all right. All over the world you have over-the-counter medicines. So short-term therapy is different. But if you are on long-term medication, please question. Is it justified that you require these drugs? And look at it. Check your albumin in the urine and your serum creatinine every year at least if you have diabetes or blood pressure. Yeah, thank you very much.
So that was a splendid lecture presented with great clarity and lucidity and wit. There was a lot of information and not a single dull moment. And we have a beautiful booklet too. So thank you very much, Dr. Ravichandran. And I think it's gratifying that the South India Heritage Program, besides lectures on the heritage, we have an occasional lecture on health and wellness. We had one on yoga, we had one on diabetes, and today a very useful one on kidney problems. Now, we'll know whom to go to should any kidney problems strike. Thank you so much, Doctor. The next event of the South India Heritage Program is on August 28th. Mr. Randor Guy will speak. Mr. Chari is bringing out a book of writings by Randor Guy. I think Mr. T.S. Gopal is editing it. So that book will be released and Randor Guy will speak. And this is in connection with Madras Week. Madras Week is between August 21 and 28. And we celebrate Madras. Yeah, correct. There's also a documentary film on Madras based on a lecture by Mr. Muthaya. This is a 50-minute film on Madras. That will be released as well on that day. So thank you very much and have a good Sunday.